Globally, diabetes ranks among the top 10 causes of death. And in the African region, 24 million adults live with diabetes, a number projected to increase to 55 million by 2045. Addressing the press at the launch of My Lay Diabetes Doctor book, consultant endocrinologist and author Professor Ernest York indicated what prompted the release and writing of the book.
I found that there are little holes in the piece and the jigsaw that make sure that diabetes patients come out well. You've myths surrounding diagnosis, the misunderstanding over the disease condition is, the support system that are not unavailable, the medications that are expensive, and the materials that are not needed to be able to check their glucose on a regular basis. So having experienced all of these, we decided that let's crystallize these experiences that are shared between practitioners and patients for the general public. So this book really is meant for the patient living with diabetes, the lay public, and the ordinary person to understand what the disease condition is, how to live with it, and come out with flying colors in terms of preventing complications.
With about 2.4 million people living with the condition in Ghana, he further expressed the need for expectant mothers to get checked for diabetes during gestation. This, he believes, will help reduce the prevalence of the disease among young people.
Every pregnant mother, if you didn't know you have diabetes before you became pregnant and you are at least 6 months old, ask your doctor to check your system for glucose levels, because the black patient, the Ghanaian, is at high risk of developing diabetes. And not just the developing diabetes that we're worried about, it's the complications that come with it, both to the mother and or the baby. So patients or babies that are born to mothers who have diabetes may have big heads, early delivery, they may be prone to having cesarean section, that's having an operation to deliver the baby, and many others. So we don't want that. And babies are precious to mothers. So we're saying that let's screen you when you are pregnant at the age of 6 months if you didn't know you have diabetes. And if you do, can listen to the conversations that you have with your healthcare practitioner. As an adult who is well, at least you should check your blood glucose once a year. But let's say you come to the hospital with an emergency condition, you have been pregnant before and your sugars have been high, you've given birth to big babies, you have hypertension, you have cholesterol problems. In such persons, it is mandatory that you check for your glucose levels. You never know that what may be found, and if it is found and is treated quite urgently, it prevents complications.
He further called for government intervention in supplementing finances for the purchase of diabetic drugs and supplies.
Patients can't do it alone. NHIS is doing it bits, but we need support for patients in terms of one, the diagnostic tools, checking blood glucose levels. It's quite expensive. The medications, the newer, more sexy, the most effective ones are not on the NHIS. So that's important that the government steps in and there's more advocacy, from some of us that this ought to be done.
For Nino Ikwe, a beneficiary and also a person living with a condition, the move is a step in the right direction in aiding young adults who are faced with the ailment at an early stage.
It's my dream, and I hope that other children who are my age or younger who are living with diabetes also get the kind of support or even more than what I got, so that they can also achieve their full potential.